Honorable Gustav.
Good evening and welcome to Medical Mondays with Dr. O, your interactive platform for all health-related topics. This evening, we will continue with our discussion on lifestyle changes with an expert in the field. Kindly drop your questions and comments in the chat box, or you can raise your hand, and then we will acknowledge you to ask your questions. Remember that also on the YouTube channel, so you can catch up with all the previous editions of the program on your YouTube channel, Medical Mondays with Dr. O. Now, Dr. O is a fellow of the American Academy of HIV Medicine, the family practitioner, CEO, and medical director of Gennesaret Medical Center. She is committed to changing lives wherever she goes through healthcare. Help me welcome one of the nation's leading community health advocates and renowned medical mission expert, Dr. Toyin Opesami. You're welcome.
Good evening. Welcome, everybody. And sorry for the technical difficulties. You know, when things work right, it's fantastic. Occasionally, we get these hiccups, but we always would overcome them, thank God. We have an amazing evening coming forth because, as you know, we've been talking about lifestyle changes with changing our diet, exercising. We had live exercise with Tonya Anderson last week, and sleep. Dr. Jagbe has talked to us about sleep, you know, on different occasions. But guess what we have tonight? Dr. Angela Holliday-Bell, a board-certified physician, certified clinical sleep specialist, and sleep coach. How better can it get? That we're going to learn about how to sleep better and well tonight. She attained a master's in biotechnology from Rush University, her MD from the University of Illinois in Chicago, my alma mater. I went to University of Illinois at Circle Center in Chicago also. And she completed her training as a physician in Washington, DC, where she went on to receive a certification in clinical sleep health. Her sleep blog has been featured as one of the top 50 blogs in sleep, and she has contributed to a number of online and print publications. She is the founder and CEO of a sleep coaching company, The Solution is Sleep LLC, that was created to help busy women professionals live happier, healthier, and more productive lives through better sleep. But not only female professionals, male also. So don't feel left out, a gentleman on the forum. We're all going to learn so much from Dr. Angela Holliday-Bell. So,
excellent.
I'm handing over the baton to you. Welcome.
Okay, great, thank you. Thank you so much, Dr. O. Thank you for that introduction, and thank you so much for having me tonight. Sleep is literally my favorite subject to talk about, so I'm always happy when I can discuss sleep with everyone and help people get better sleep. So I'm so excited for the presentation we have tonight. As was already mentioned, if you have questions, please feel free to drop them in the chat, raise your hand. I'll be going through some slides, but I want it to be informal as well. I want you to be able to kind of interact and engage, so feel free to ask questions at any time, right? So let me start by sharing my screen here. All right, so tonight we're going to talk about how to sleep your way to a healthier you. Okay. Again, I'm Dr. Holliday-Bell, board certified pediatrician, as well as a certified clinical sleep health specialist. So first of all, let's talk about why we're talking about sleep, right? We know that we all sleep, feels good when you can do it, doesn't feel great when you can't, but why is it so important to talk about it? Why have I dedicated so much of my life to talking about it? Well, if we're lucky, we spend a third of our lives sleeping, right? That's a significant amount of time that we spend in this state called sleep. And unfortunately, the amount of sleep that people are getting has significantly decreased over time. In fact, in the 2014 CDC report, about 35% of adults in the US reported having short sleep duration. And that is defined as sleeping less than 7 hours per night. And over the past century, what we've seen is that the amount of time that we're sleeping at night is slowly decreasing now to 1.5 to 2 hours shorter than it had been previous to that. And what's even worse, about a third of the working population reports sleeping less than 6 hours per night. So many people are not getting enough of the sleep that they need. Again, why is this important? It's important because sleep is important for every single aspect of our health, as we'll discuss a little bit further in this presentation. It's literally easier to say what sleep doesn't affect than what it does affect, because it literally is so important for every kind of facet of our functioning. And so much so that in 2009, the CDC deemed sleep deprivation to be a public health epidemic, because so many people were missing out on the sleep that they needed. And it was affecting health so significantly that it became something of public health concern that they knew that we needed to do something about. With over 50 to 70 million US adults suffering from chronic sleep and wakefulness disorder. Okay, so what happens if we don't get enough sleep? What's a big deal? As I mentioned, insufficient sleep affects both your physical and your mental health. Short duration of sleep has been associated with increased risk of subsequent overweight and obesity. And as Dr. already mentioned, we know that that's super important, right? You guys just had someone speak to you about how to be healthy and have a healthy diet. And really, sleep is also a big part of that. If you get insufficient sleep, your body actually produces more of the hormone that makes you hungry, called ghrelin, and less of the hormone that makes you full, called leptin. So you are physiologically more likely to gain weight if you're not getting an adequate amount of sleep. You also are less likely to be active, as you have less energy during the day to burn off those calories. And then you're up more time, so you're more likely to eat just for because of the sheer amount of time that you're up. And you're less likely to make healthy dietary choices when you haven't had enough sleep. So literally, skipping on sleep creates a perfect storm of increased weight and obesity, which, as we know, leads to so many chronic diseases down the line, like high blood pressure, cardiovascular disease, diabetes, just to name a few. In addition, sleep deprivation impairs our attention, working memory, as well as our long-term memory and decision-making. So you literally just function at a less efficient place than you would otherwise had you gotten enough sleep. So a lot of people like to say, well, I can't go to sleep because I have so much to do, or I have work that I have to get done, or I have to get up or work early. And you literally would function so much better and more efficiently if you prioritize sleep and got to sleep than if you stayed up late. So I was trying to reframe people's thought in that way. Like, your memory is impaired, your decision-making, your reaction times are impaired if you're not getting enough sleep. So the best thing you can do to help your functioning the next day is to sleep. And this is not just significant decreases in sleep. This is not if you're only sleeping 4 hours a night. Small decreases, even missing out on 1 hour per night, can lead to all of these negative downstream. So there are also research studies that are being done to investigate the effect of sleep on developing your risk of infection. And in the world of COVID, this is super significant because we're doing so many things to figure out how to keep ourselves healthy, vitamin D and zinc and vitamin C and all these things. Now realizing that one of the best things we can do to help us decrease the risk of infection and keep ourselves healthy is to sleep. There are studies done in adults and animals that suggested that short sleep durations actually blunted their ability to mount a response to an infection and to immunization. So there was a study specifically done in about 153 healthy adults between age 21 to 55. And they split them up into two groups. One group slept less than 7 hours per week for 2 weeks leading up to the experiment. The one slept at least 8 or more hours. And what they did was expose each individual to the rhinovirus, which is a virus that causes a common cold. And then they followed these individuals for the next 2 weeks. What they found was that those individuals who slept less than 7 hours per week in the 2 weeks preceding the exposure were almost 3 times as likely to develop signs and symptoms of a cold than those who slept enough, which is really significant when you think about it. When you think about all the viruses we have floating around, all the things that we're exposed to every day, one of your biggest lines of defense is really just getting enough sleep. And this is when they controlled for factors like the antibodies they had to that virus prior to the exposure, their demographic, socioeconomic status, gender, all these things were kind of controlled for. The only thing that was significantly different was the amount of sleep. And then there's also research that has been done on our body's ability to effectively respond to vaccinations when we've gotten sleep versus insufficient sleep. There's a study that involved 125 people between the ages of 40 and 60, all non-smokers, relatively good health. They were given the standard 3-dose hepatitis B vaccine. And they found that those who slept less than 6 hours on average per night prior to getting the vaccine and then subsequently after were 11 and a half times more likely to be unprotected from the vaccine than those who slept more than 7 hours on average. And that's because when you sleep, that's when your body goes to work. That's when your body doesn't have to focus on keeping you awake and doing all these other functions. It can release the antibodies. It can facilitate the movement of these things to your lymph nodes, cytokines. It does all the kind of cleanup work that you can do during the day. And when you skimp on that sleep overnight, you're robbing your body of the ability to do that. And it shows up in things like this and in becoming sick more easily and in not mounting a significant immune response. So like I said, in the world of COVID, I would take all that I can get to keep myself healthy and safe, and sleep is one. Shifting gears a little bit, there is definitely a link between lack of sleep and cardiovascular disease. So aside from the risk of obesity and overweight that we already discussed, which we know are risk factors for cardiovascular disease in and of themselves, lack of sleep puts your body into a high stress state. So your body becomes naturally stressed when you're not getting enough sleep. So it increases the production of the stress hormone, cortisol. Increased cortisol leads to increased inflammation. And we know that prolonged, especially generalized inflammation, leads to systemic disease such as high blood pressure, heart disease, diabetes. You have the risk of those things on top of the risk that you already have from overweight and obesity. And so it definitely leads to some negative downstream effects. If that wasn't enough, for those of us who've heard about beauty sleep and, some women and men out there who want to look your best on a daily basis, not getting enough sleep can definitely lead to signs of aging and changes in your skin and overall complexion that, some people might not find as desirable because lack of sleep leads to an increase in the enzymes that break down collagen and elastin. And it also causes thinning of the skin. So if you are constantly breaking down your collagen and elastin and thinning the skin, it leads to wrinkles, sagging skin. It also weakens and dilates the blood vessels under the eyes, which leads to dark under eye circles. So you may have noticed after you missed out on a few nights of sleep, you have those bags, you have those dark under eye circles, and that's why. Also, as I mentioned, your body is really going to work as you're sleeping overnight. So less time to sleep equals less time to repair skin cell and damage. So it leads to age, spots, dull complexion, and then inflammatory skin conditions like acne, rosacea, and so forth. And then what's really super significant is the effect of lack of sleep on mental health. Patients with insomnia are 10 times as likely to have clinical depression and 17 times as likely to have clinical anxiety as those who don't suffer from insomnia. Obstructive sleep apnea is a significant disorder and condition in the sleep world and in health in general. We know that impairs the quality of sleep as well as generally the quantity. And there's a study of nearly 19,000 people that found that those who had obstructive sleep apnea were, I believe, 4 times as likely to suffer from depression as those who, 5 times as those who didn't. And then even in our young adults, there was a study done at the University of Michigan that found that young adults with insomnia were 4 times as likely to develop depression. So as I mentioned, it's easier to say what won't be affected, what won't be affected if you suffer from insomnia and lack of sleep than what will be affected because so much of your body relies on those processes that happen while you're sleeping. So now that we know why sleep is important, how much lack of sleep can really affect your overall health, let's talk about how much sleep you need and how to get that better quality. So one question I get asked literally all the time is, how much sleep do I need? And it's never a straightforward answer because I like to say sleep need is like shoe size. There's no one size fits all. Our sleep need differs and there's a range of sleep needs. So you may hear that number, the number 7 to 8 hours thrown out, but that's an average, right? Just like the average woman's shoe size is 7.5. Some people will wear 8, 9, 10, some people wear 6, 5. There is no one size fits all. So I always recommend that individuals determine what their individual sleep need is because that is what will determine whether or not they're getting the amount of sleep they need to generate all these health benefits. Now, there are some genetically short sleepers who need 4 to 6 hours of sleep, which accounts for about 1% of the population. So you may have heard people say, oh, I only need 4 hours and I'm good. And I would like to say, just because you can get by on 4 hours of sleep does not mean that you are functioning optimally on 4 hours of sleep. And we'll talk in a little bit about what that really means. So it's not about you being able to exist. It's about being able to be your best self. And you need to determine what that individual number is for you. There are also genetically long sleepers that need closer to the 9 to 10 hours of sleep. myself being one of them, I found that my sweet spot is right around the 9.5-hour mark. If I were to get 7 hours of sleep, even though that's an average, I feel awful. Like that's not enough sleep for me. I'm not able to really function throughout my day. So I had to determine what that number was for me. And for me, that was 9.5 hours. So this is my definition of what sleep need is. It is the amount of sleep you require to feel fully rested throughout the day, able to function optimally while completing your normal activities with adequate energy and without requiring supplemental energy/alertness boosters such as caffeine. It's a mouthful, but that is what that is. So it's not how much you can get by on, how much you can kind of get through work. If you have 5 cups of coffee and you're good, like, no, that's not your sleep need. If you're needing these boosters just to get through your normal activities and function optimally with increased energy, you're not getting enough sleep. So one thing I like to recommend for those who have the luxury of doing this, and I definitely understand that not everyone does, is to take a sleep patient. Some people may say, I don't know, I'm constantly functioning off of sleep debt. I really don't know how much sleep I need. And so this is a situation where you take 1 to 2 weeks where you have no daytime constraints, no work obligations. It can be, you know, if you have kids or anything, that's fine, but if they're not like waking you up earlier than your scheduled time, pick a set time to go to bed. So around the time you naturally get sleepy, which would be ideal. For some people, you may naturally be a night owl. I personally am, so I would normally get sleepy around 11 or 12. I just tend to go to sleep earlier because that doesn't fit with my schedule on a normal basis. You just allow yourself to wake up naturally. Initially, you're going to be sleeping off some debt. So the sleep that you have missed throughout the week adds up, which is why most people tend to sleep in on weekends because your body is trying to compensate, although you can never fully compensate for a night of lost sleep. But after a few nights, your body will get into its own natural rhythm. And however long your sleep, from the time you naturally go to sleep to the time you find that you're naturally waking up without an alarm clock, without any other outside thing waking you up, that's the amount of sleep that you need. And then going from there, I would aim to get that amount of sleep moving forward. You also want to avoid any like stimulants or sleep aids because you don't want anything else contributing to that. You want it to be your body's own natural process. And so I want to talk a little bit about what dictates your sleep before I get into how we can fix some kind of common sleep issues. So there are 2 main processes that dictate sleep. You have process C and process S. Process C, you're probably all familiar with, is your circadian rhythm. It's actually roughly a little bit longer than 24 hours, but it's a cycle that we go through every single day. And actually all of our cells have circadian rhythms in them, and it dictates when certain processes happen. So for most of us, we get alert early during some early time in the morning. We have a mid-afternoon kind of slump. A lot of us have an early evening burst of energy, and then we get sleepy later on. And no matter how much sleep you get, your body will still kind of go throughout this rhythm. So for instance, for all of my docs in the chat, you may have been familiar with working 24-hour shifts. And sometimes, even though you've been up for 24 hours, once you kind of hit that daylight morning time, you kind of have a little bit more energy than you did a few hours ago. And it feels kind of weird to like, you know, why am I a little bit more energized even though I've been up longer? And that's because this process C is working to alert you even if you haven't got as much sleep. But at the same time, there's a simultaneous process S, which is your sleep drive. And that very simply increases the longer you've been awake. So the more time you've been awake, the higher your sleep drive. And these 2 processes sometimes work in conjunction and sometimes work in opposition with each other. But you have to take advantage of each to get your kind of sleep life to function optimally. All right, so let's talk about how specifically to set yourself up for a good night. My number 1 recommendation when it comes to getting good sleep is to prioritize your sleep. So often we leave sleep as the last thing that we do at the end of the night. We go to work, we take care of kids, we have to cook, we have to clean, we have all the things that we have to think about. And then we think that once we shut the lights off, we just fall asleep. For some people they do, and God bless those people. But for a lot of us, our mind doesn't just shut off like that just because we say it's time to go to sleep, right? We have to set up environments. We have to set up things during the day and the night that help to facilitate that sleep. And so it really starts by prioritizing sleep. What time would that be for you? How much sleep are you going to be getting? What is your bedtime routine? We'll talk about it in a little bit. Put yourself and your sleep first. That's really the first and best step you can do towards getting. So the number 1, so after prioritizing your sleep, the next thing you should do is to determine what your bedtime and bedtime routine will be, right? So you should have a consistent bedtime every night because that helps to reinforce your circadian rhythm or the process C that we talked about. Doing something at the same time each day reinforces your body's schedule. It makes it much likely that you'll fall asleep at the same time if you're continuing to go to sleep at the same time each night. And so you really want to try to keep that within 1 hour of the same time each night. So if you decide that, on a weekday, you're going to go to sleep at 9, get up for work, let's say at 5 or 6, you want to make sure even on the weekends, you're still going to sleep between 9 and 10, or I guess between 8 and 10, because you want to help to reinforce that schedule. Going to sleep hours later, let's say on the weekends, really throws off your circadian rhythm and makes it much more difficult to get back on track for the week. And that's actually something we call in the sleep world social jet lag, where your circadian rhythm is advanced a few hours over the weekend, and then Monday you try to go back, and it's almost like traveling across time zones because your circadian rhythm has sped up a few hours, and so it's really hard to do that in a matter of a night. And you should have a bedtime routine, so it should be something that is at least 45 to 60 minutes long, include 3 to 4 soothing activities, and most importantly, be consistent from night to night. So when it comes to sleep, it's just as much of a mental activity as it is physical. And you want to train your brain to connect certain things with sleep that make it easier to make those connections day after day, because our brain is constantly trying to make our world simpler by making connections, right? All throughout the day. Just like you may be, let's say you're studying in the kitchen or doing some work in the kitchen, and you find yourself going to the refrigerator to get something to eat, and you weren't even hungry. Your mind connects the kitchen with eating. I'm in the kitchen, so I eat. So you want your mind to connect the activities that you do for sleep with sleep, so that once you do them subsequently, it makes it easier for you to follow. And so I always say, especially for my busy professionals out there, make your bedtime routine your me time. Like we spend so much of our day giving to so many other people and everyone else. Make this your time that you give to yourself. Make it relaxing, something that you look forward to make it more likely that you'll do it, and also make it easier to relax and decrease stress and fall into sleep. So make it fun, make it something that you find enjoyable. You want it to be devoid of electronics and even bright overhead lights. So I think a lot of us know of the recommendations to avoid blue lights, like on electronics, computers, televisions, because that specific wavelength of light, the blue light, interferes with our natural melatonin release, and it can push it back by as much as 3 or 4 hours, even with just a couple minutes of viewing. However, your bright overhead lights can do the same thing. So ideally, you'd have dimmers that you can put on 1 to 2 hours before you go to sleep, or at least have like bedside lamps or table lamps that you're using, because the dim lights will facilitate your natural melatonin. And then if you don't have dimmers or you need lights on for other reasons, you can consider blue light filtering glasses 2 to 3 hours before bed to kind of have the same effect. You want to filter out that blue wavelength of light that keeps you up, to help facilitate your natural melatonin release and make it easier to fall asleep. And then I recommend performing some sleep promoting activities. So taking a hot shower is great. Your body temperature actually has to drop by 1 to 2 degrees before you fall asleep. By taking a hot shower, your body has to decrease its temperature to cool you off. And so it actually, for most people, helps them fall asleep a little bit easier. Listen to soothing music, read a book by dimmer light. Meditate, just something that relaxes you, that you can do, that's consistent each night, you look forward to help facilitate your transition into sleep. So it's not just, okay, I had my busy day, lights off, trying to fall asleep. We need to kind of ease our way into that. So what if you do this? You set your bedtime, you know what your sleep need is, you're ready to go to sleep, you have your bedtime routine, and then you can't fall asleep. Unfortunately, that is a reality for so many of us, and luckily there are some things. So the first thing you want to do is take part of stimulus control. So stimulus control is really a technique that helps you to strengthen the relationship between your bed and sleep. Again, you are working to make mental connections between sleep, and your sleep routines are the things that connect you to sleep. And obviously your bed is the biggest thing to do that. So you want to take out anything else that dilutes the relationship between your bed and sleep to make that stronger. So that as soon as you see your bed, your eyes start to droop. Like your bed should just be your sleep haven. So the first thing you want to do is only go to bed when you're sleeping. And that sounds simple, but it's actually super important. So I said to, keep a consistent bedtime routine and keep a consistent bedtime. The asterisk by that is if you're not sleepy at that bedtime, don't go to sleep. Don't get into bed, because what happens is when you get into bed where you're not sleepy, you are laying in bed awake, you may be anxious, tossing and turning, thinking about falling asleep. And then your mind starts to connect being in bed with being anxious and tossing and turning and trying to fall asleep, and it dilutes the relationship that it has with sleep. So you want your eyes to be drooping, ready to fall asleep before you get into that bed. By trying to do your bedtime routine and keeping the bedtime consistent, you are more likely to make that at the same time each night. But if you get to that time and you're not sleepy, don't get into bed. You want to avoid all activities in bed besides sleep and adult activities, because if you are in the bed and you're talking on the phone and you're eating and you're watching TV, again, you get into bed and your brain says, oh, this is where we do everything else but sleep. We talk on the phone here, we laugh, we do all these things. And so it is weakening that connection. And then very importantly, and I think this is it's counterintuitive for a lot of people and hard for them to stick by, but super important. If you get into bed and you're unable to fall asleep in 15 to 20 minutes, whether you're first getting into bed or in the middle of the night, you should actually get out of your bed for the same reasons we just talked about, right? So for a lot of people, some people have sleep onset insomnia, so they have problems falling asleep. There are a lot of people who have sleep maintenance insomnia. So I fell asleep, but then I wake up and then I can't go back to sleep for another 2 or 3 hours. So what do? I sit in bed and I try to will myself to fall back asleep. And I say, okay, if I can just fall asleep, I can get 4 more hours. I can get 3 more hours. And that causes your brain to continuously go. And that can be so strong that it can lead to something called psychosocial insomnia, or I'm sorry, psychophysiologic insomnia, where you could be someone who's completely exhausted, ready to pass out. But as soon as you get into your bed, you're wide awake, anxious, thoughts are racing because your mind is so used to that being what you do in bed, laying in bed, trying to fall back asleep. So if you can't fall asleep in 15 to 20 minutes, get out of bed, ideally in a separate room, go back to those relaxing activities. Listen to calming music, fold clothes, read a book, do something else to get yourself sleepy. And then when you're sleepy again, you get back into the bed. As soon as you get back into bed, you fall asleep and you're strengthening that relationship, and you make it less likely that subsequent nights you'll be up in bed lying awake. And then another thing that can be helpful in promoting sleep is learning how to trigger the relaxation response, which is actually super powerful. So the relaxation response is a physical state of deep rest that changes a person's physiologic and emotional response to stress. So you actually have control over how your body perceives and responds to stress. And the relaxation response helps you to literally decrease your own heart rate, decrease your respiratory rate, thus decreasing your blood pressure. And you are then telling your body, no, we're relaxed. Even if you started out feeling stressed and anxious, you are changing all of the, literally your vital signs and your physiologic response, so that your mind is saying, oh, my heart rate is decreasing, my respiratory rate is decreasing, I must be relaxed. And that is the state you need to be in order to fall asleep. And there are many ways to do that. It does take some, practice and something you have to work at, but definitely once you learn this skill, it's invaluable. And it doesn't have to be only when it comes to sleep. In other kind of, anxiety-ridden or stressful situations, you can also learn to trigger this. But some things that I recommend that are helpful are deep breathing exercises, meditating, progressive muscle relaxation, and guided imagery. And there are apps on your phone that can help you to do this, websites. There are so many things dedicated to teaching you how to do this. And really it's something that you can add into your bedtime routine. And again, it's something you can have your brain connect to falling asleep, making it easier to fall asleep on subsequent. So there are some substances that we can partake in during the day that can interfere with sleep. So a big one is caffeine. So many coffee drinkers in the world. I love coffee also personally, so I understand. However, it's something that we use often to get over a sleepless night and to make us more awake, but we're not always aware of how that could be contributing to the cycle of being unable to fall asleep. So you think about it, caffeine has a half-life of 5 to 6 hours. That means that after, let's say, 5.5 hours, half the amount of caffeine you took is still in your system. So if you are having that late afternoon cup of coffee, by the time you go to bed, you still may have a significant amount of that caffeine in your system. And we know that caffeine is a stimulant, so that can make it harder to fall asleep, especially for those who are more sensitive to the effects of caffeine that can last even longer. So I say, as a general rule, you should avoid caffeine after 12 p.m. If you want to use it as your little pick-me-up in the morning, that should be fine. But you want to make sure you give yourself enough time for a significant amount of the caffeine to be out of your system. Similarly for alcohol, so I think a lot of us are familiar with the nightcap. You may have a couple glasses of wine or a drink, and it makes you feel sleepy at first. So you feel like it's something good to do for sleep. But the problem with alcohol is that while it's initially sedative, it does make you sleepy. It's broken down very quickly. And once it's broken down, it becomes a stimulant. So you may notice after, a night of fun and libations, you actually have more broken sleep because you're more likely to wake up in the middle of the night if you've had, a few drinks before bed than if you didn't. So I say, avoid 3 to 4 hours before bedtime. A glass of wine with dinner should be fine as long as you have that space in between so that it's not interfering with your quality. And then what to do about napping. So napping is excellent if done responsibly, is what I say. Power naps can be huge and beneficial to give you an extra boost of energy and alertness during the day. But if your naps are too long, it can actually interfere with your nighttime sleep. So a power nap is something that really should be limited to no more than 10 to 30 minutes at a time. And that's because as you cycle through your sleep stages, you go from progressively lighter to deeper stages of sleep. If you nap for longer than 30 minutes, you're more likely to get into the deeper stages of sleep. And if you're awakened from that stage, you experience something called a sleep inertia. So it's harder to be awake. You have that groggy feeling, and that's because you've gone too deep in the sleep stages. If you stay in those couple lighter sleep stages, you still get that increased boost of energy and alertness, but you don't have that sleep inertia and the grogginess. And you also want to avoid napping after 3 p.m., as well as if you have chronic insomnia, like if you have a disorder of chronic insomnia and you're really trying to get your sleep together, you really shouldn't avoid napping altogether because that process, as we talked about, the longer you stay awake, the higher your drive to sleep is. Napping steals from that drive. So instead of it building up all throughout the day and you being able to take advantage of it at night, you sleep some of that off, and then it's harder for you to fall asleep. But I think once your sleep, sleep cycle and sleep routine are in order, power naps are excellent. I definitely love a good power nap. So there are some substances that can help with sleep, and 2 main ones that I tend to utilize and recommend. So first you have melatonin, which is a naturally produced hormone. It's produced in our pineal gland, and it helps to set the stage for sleep. So you have a decrease in light that signals to your brain that, oh, it must be getting dark and time to fall asleep. It releases melatonin and it helps you to fall asleep. But you can also use that in supplement form. The key to using melatonin is to use in the smallest effective dose, which even for adults is really 1 to 3 milligrams, and slowly titrating up by like 1 milligram to your effective dose. So some people make the mistake of thinking more is more, and really that's not the case. There have been some reports of having taking more than 10 milligrams actually having the opposite effect on your sleep and making you have less quality or poorer quality of sleep. You want to start slow. There's also time to release melatonin. So for those who have trouble maintaining sleep throughout the night, time to release slowly releases over 6 hours and more closely mimics our physiologic melatonin release. And so it can be helpful in certain individuals. I really prefer melatonin as like a backup. If you have had this situation where you're going to sleep later for a few nights, maybe coming off vacation, use melatonin to kind of get things regulated again, and then just have it as a backup if you have, an off night or something like that. Because really most sleep issues can be fixed with just kind of the sleep things that we talked about. But my probably favorite sleep supplement is actually magnesium, which is a naturally occurring mineral that can definitely be obtained from foods, but you can also get it from a supplement. And what magnesium does is it's a cofactor for the neurotransmitter GABA, which is a transmitter that slows everything down. It actually helps to relax your muscles, the smooth muscles in your GI system, your skeletal muscles, everything kind of relaxes. And thus it facilitates the transition to sleep. And that's something I think can be taken every single night. And I think it's helpful to treat anxiety. It's helpful to treat so many things. In terms of dosage, I usually recommend that women do 310 milligrams a night and then men 420 milligrams a night. So I would do that and then just have melatonin as a backup. And I think that way, you have something in your back pocket in case you're having trouble. And then after we've done all these things to help us fall asleep and stay asleep through the night, what time should you be waking up? So your morning wake time should also be consistent. So you want to keep that within an hour day to day, even on the weekends. Even if you didn't get a good night's sleep, you should keep the same wake time. Again, that helps to not only reinforce your circadian rhythm to make it so that you're more likely to be alert at the same time each day, but it also takes advantage of your sleep drive. So even if you slept poorly the night before, the longer you're up, the more likely you are to fall asleep the next day. And so you're able to get back on track sooner than if you just sleep in and then it kind of becomes a cycle. And so what do you do if all of this isn't working? You've tried all of these things and you've gotten to this point and you're like, I'm still not able to get sleep. And I know how negatively this can impact my health. So what do I do? And unfortunately, there are many people who suffer from chronic insomnia, which is a sleep disorder. It's not, I just don't prioritize my sleep. I just don't do all the things I should for sleep. This is, I've tried all those things and I have this disorder where I can't fall asleep. And it's defined as difficulty falling or staying asleep at least 3 or more nights a week for 3 or more months. And it's insufficient sleep despite adequate sleep opportunity, which is really important. So it's not like I'm only sleeping 6 hours a night, but I go to sleep at midnight and get up at 6. That's the only amount you can sleep if you go to sleep at that time. I give myself 8, 9 hours of sleep opportunity, but I just can't, reach the amount of sleep that I need to feel rested. And the number one treatment for that is something called cognitive behavioral therapy for insomnia. And this is a therapeutic approach that addresses maladaptive thoughts and behaviors surrounding. So it goes deeper than just kind of these routines we talked about. Generally, this is something that happens over time as you've had all these kind of chronic behaviors and things that have a snowball effect that we have to peel back layer by layer. It really helps to uncover and fix the underlying cause of your insomnia instead of putting band-aids on it, like prescription sleep pills and things like that have not been shown to work, especially long-term. It utilizes the stimulus control we talked about, but also a technique called sleep restriction. And it has been shown to have long-lasting effects, even more effective than prescription sleep medicine or medications, and now is the number one recommended treatment for those who suffer from chronic insomnia. And that's a little bit of what I do on my personal coaching site, The Solution is Sleep. I provide one-on-one comprehensive sleep consultations with people who just need a little bit of help getting their sleep routine on track, or just need an assessment to make sure there are no sleep kind of disorders, which we really didn't touch on too much today. But I also have an online course based on the principles of cognitive behavioral therapy. And I have a one-on-one 5 to 6 week comprehensive intensive therapeutic sessions where we meet one-on-one each week, we go through the cognitive behavioral therapy trainings, and we follow the sleep from the beginning to the end, and focus on increasing and improving sleep quality and then sleep quantity, and arm you with all the things that you need. Should you fall off and have issues in the future, you already know how to respond and get your sleep back on track. So that's really all I have for you, lovely people, today. Thank you so much for having me. Let me know if you have any questions.
Thank you so much. That was, very educative. I learned some things there. Magnesium is very important, and I have not used it for sleep.
Mm-hmm. Yes,
it's actually very helpful.
Thank you.
Sorry?
I say, yeah, it's excellent for sleep. And magnesium glycinate in particular, bisglycinate is the formulation that's the most helpful.
Fantastic. Dr. Holliday-Bell, can you take down this slide deck so that we can have more faces? Fantastic. So you talked about social jet lag.
Yes.
It's like sleep jet lag.
Mm-hmm.
Can you expatiate a little bit on that, please?
Yes. So if you're ever taking a trip across time zones, across the country, you know that you get there and you're tired at different points of the day, your digestive system is off because your body is still functioning in your old time zone. And it takes a few days for your body to adjust. So I think it's an hour for each day that you're there, your body adjusts. So what happens is when we, let's say over a weekend, over Saturday and Sunday, decide that we're going to go to sleep 3 hours later than we did before. So go to sleep at 9 for work, and then we're midnight partying. Your body is slowly adjusting to that time difference, because now we're maybe eating dinner at 9 o'clock, we eat dinner at 7 o'clock. And now instead of winding down and our natural melatonin release being at 8 p.m., because that's when we lower the lights, now it's at 11 p.m. And so it's actually treating and tricking your body into thinking it's across a few time zones. But then here comes Sunday, and I have to go back to sleep at 9. So you're flying back across those time zones, and then you expect yourself to fall asleep again. And your body is like, wait, I got to adjust again. So now we got to wait a few days for you to get back, on a regular schedule if you do it all over again. So That's why so many people suffer with, insomnia, particularly in the first few days of the work week, because you just tricked your body into thinking we're 3 hours ahead, and now you're trying to hurry up and go back, and it just is very.
Wow. So, that's very important, especially with the new things we learned about. I think it was about 6 or 7 years ago when the research came out on how the brain cleans out itself, and it does it in sleep. And it was discussed also how many hours of sleep is needed. You're right, one size does not fit all, but it's kind of difficult in our lifestyle when, for instance, we can maintain the sleep pattern during the week, and then at the weekend, maybe my son is getting married.
Yeah.
And we're gonna party all night, and then, so what do you suggest with that? Life happens, and we have to, support each other, attend functions and stuff like that. So how do one handle that, maintain that?
That's a good question. That's an excellent question, because, a lot of my friends for sure have later bedtimes than I do. And especially when it comes to the weekend and you have the constraints, it's hard. But I think the key for me, and when I work with my clients, is make your baseline and your standard be that you go to sleep within 1 hour of the same time each night. And then if once a month or once every other month, you're out a little bit later, or even a couple, some people can bounce back and adapt a little bit easier than others. As long as you kind of set that as your baseline, it's easier to get back onto a normal schedule if it happens every once in a while. But if it's an every single weekend thing, your body is so confused, because literally every few days it's going across time zones. But if it's like, all throughout the weeks, you're having a consistent schedule, and then you're off 1 or 2 nights, it's so much easier for your body to adjust. You're still going to be alert at typically the same time. You're still going to be sleepier at the same time. You can kind of bounce back. And then remembering it's within 1 hour. So like for me, I'll just put my schedule out there. I tend to go to sleep at 10 o'clock on weekdays, and I wake up at 7. And then on weekends, I try to go to sleep around 11, which for me is like, good enough. And I'm like, I'm gonna be so much better of a person if I get sleep on the weekends and during the week, that it is worth having some kind of social restraints a little bit. And then for the times that I really do want to celebrate an occasion or be out with friends, I'll take the time to do that. So it's all about that.
Thank you. Thank you so much. That's so helpful. I think Auntie Tawa has her hand raised. Can you unmute and ask your question, please? Yeah. Go ahead.
Good evening, everybody. Thank you, Dr. Angela. What is the solution for the people that work midnight shift?
That's an excellent question. So shift work is a particularly difficult sleep pattern because it just goes against our natural circadian rhythms. However, if it's consistency work, so if you're consistently working night shift, it is easier to adjust your schedule to the night shift. And honestly, melatonin becomes more important in those situations because it helps to kind of change up your circadian rhythm better and more effectively if you take melatonin after your night shift, especially if you're being exposed to like daylight when you're coming home. So you want to tell your body, no, it's time to go to sleep. We're getting into, our light and deeper sleep stages, and melatonin is the most effective way to initiate that process. So it still is about consistency, and that the harder thing on your body is when you jump back and forth. And unfortunately, I understand that for some people, we can't help that. We have shift work. I know during residency, I was on night shift, and overnight, and day shift, and all that. And there's nothing I can do about it. But if you're working a consistent shift, have your sleep be consistent as well. So you're working midnight to 8. You come home, you sleep 8 until whatever time is enough for you. You're awake during those times to kind of keep that consistent. Take your melatonin, and it won't have the same kind of negative effects as if you're constantly switching back and forth.
Thank you.
Thank you so much, Dr. Holliday-Bell. There are a couple of questions in the chat box. We compromise a lot with our sleep routine. This is affecting many people knowingly and unknowingly. I appreciate you letting us know that we should prioritize sleep. Thank you so much. And then Susan Osufade says, thank you for all these ways of getting some good sleep. Despite all these, at a certain age, all these fly off the window. Do you encourage the use of OTC medicines and or different teas to help out? Can you shed some light on ginger fit bath before bedtime?
That's a great point, Susan. So when we think about sleep, it definitely changes as we age. And as you get older, you are less likely to have the deeper stages of sleep. And you're less likely to have the same quantity of sleep as well. Also, for us women out there, as we go through certain changes, we are also unfortunately less likely to get inadequate amount of sleep. So you're right, it makes it a little bit tougher, but all of these principles still apply. I think some over-the-counter sleep supplements are great, some not as much. So, and I'm glad you put over-the-counter because I generally never recommend a sleep prescription medication. I don't think it's helpful for sleep. It doesn't recreate your natural sleep architecture. It actually makes you more sedated than sleeping. So you actually don't get the same benefits. You don't cycle through the stages of things. So I actually think it's never a great idea to do prescription sleep meds, but absolutely there are some over-the-counter things that can help. Magnesium being a huge one. So that's literally my go-to. I take magnesium personally every single night, and I think it's super helpful for sleep. Melatonin being another one. And again, the prolonged release melatonin to help you stay asleep throughout the night and help you achieve those deeper sleep stages. There's something called Epigenin, which is the active molecule in chamomile. Those supplements can be helpful as well. They can be a little bit strong for certain people, honestly, but I think that it can be helpful to try those. I'll be honest, I'm not familiar with the ginger feet bath, but I think if it's certainly worth trying, and if it helps, excellent. Make it a part of your routine, make it something that your brain connects with sleep. In addition, besides the Epigenin, which is the active part of chamomile tea. So the act of drinking tea in and of itself is a relaxing process and something that's helpful to have in the sleep routine. But chamomile has been shown to help induce sleep. So I think that's certainly a great addition to anyone.
Thank you so much.
Just to say, what about passion tea?
Passion tea. I don't know that I've heard that in connection with sleep. Lavender for sure, chamomile for sure, the Epigenin. I'm not so sure about the passion tea.
I prescribe that a lot, and it helps with sleep. It helps anxiety and sleep. It's
there you go. Yeah, that's the key. So I think helping with stress and anxiety for sure go hand in hand with sleep. So I think if it helps with that, perfect.
Can I contribute here?
This is Papa Dr. Mike Oye, Brother Mike Oye. Go ahead, sir.
Just on that question, thank you very much, Dr. Bell. You are wonderful.
Thank you.
There are a few other plants that have no serious side effects and that are relaxing. They are nervines. We call them nervines, but they are mild nervines, and they can relax the body, the brain, the nervous system to allow people to sleep soundly. One of them is called Terminalia Katapa. Terminalia Katapa, that's Indian almond. Indian almond, a very, very common plant, particularly for poor people. The leaves are very large. You can Google it. Indian almond. Then the passion fruit is also very good. Yeah, they are relaxants and nervines, and they help people to sleep soundly. Yep.
Thank you, sir. Dr. Mike Oye is a naturopathic doctor. Yeah. Thank you so much, sir.
Thank you. A question from Auntie Lola. I breakfast mostly late in the afternoon. I feel extremely sleepy right away after I eat that first meal. Is there anything I can do to help this?
Yeah, so I'm wondering, Lola, if that naturally coincides with the natural dip in alertness in the afternoon. So most of us within our normal circadian rhythm have this late afternoon slump. So it could be after eating lunch and maybe an hour or two after, and that's just when we naturally have a lower state of alertness. We think it's because, previous, like back in the day, we actually did have kind of two different sleep times. So people naturally did nap and then had overnight sleep. And so potentially it's an effect of that, hard to say. So it may just be lining up with that. The key is what you eat and what you do afterwards. So you want to avoid any really heavy foods, greasy foods, fattening foods, high in tryptophan, because that can make you feel a little bit sleepier because it leads like serotonin and melatonin release. I would make sure that when you are eating, you're in a well-lit room, ideally with some natural sunlight, because that helps to counteract that kind of natural slump and increases your alertness. And then again, this is probably hard, but if you are able to take a quick little power nap after you eat, I actually think the rest of your day will be excellent. You'll have a lot more energy. So I would try all those things out.
Thank you so much. Another food-related question, this time coming from Dr. William Craig. How significant is food consumption, in particular protein and the different kinds of protein, dense or not dense, and carbs? Realize that heavy dense protein consumption leads to stressful dreams.
Oh,
That it?
So what I would say is what you eat is actually important. More so what you eat and the timing of what you eat before bed can interfere or impact your sleep. A little bit of good protein is actually helpful before bed. And by that, I mean like a handful of almonds. For if you're not lactose intolerant, a cup of like Greek yogurt can be helpful. And that's because you don't want something that's high in glycemic index, that will shoot your blood sugar up. Because as it's decreasing, it will release cortisol, which is stressful and can interfere with your quality of sleep. Protein is broken down slowly and helps you feel a little bit more satiated throughout the night, so it's less likely to impact your sleep. So I would say, a good kind of serving of your simple proteins, a handful of almonds or something like that, like an hour or so before bed can be helpful. And then otherwise, when it comes to foods, it's really just avoiding things that will interfere with your sleep, like causing reflux or causing digestive issues. Again, if you are lactose intolerant, you want to avoid dairy products right before bed because those things can definitely interfere with it. Spicy foods, but I think a good amount of just healthy, natural protein, lower unhealthy carb diet can be helpful to your quality.
Thank you so much, Dr. Holliday-Bell. Another question from Dr. Bill. How does one compensate for jet lag? Before you answer that question, Dr. Buka says that a friend of mine who flies to New Zealand use magnesium for in-flight sleep. Can you please comment on those two?
Yeah, so the magnesium is great. As I mentioned before, your friend is onto something totally excellent to use magnesium for sleep. So for jet lag, it depends on the direction that you're traveling. What is most helpful is to prepare before you're. So if you're going somewhere and the time is set back, you actually want to start moving your bedtime back each night the closer you get to the trip. So if you normally go to bed at 10 o'clock our time, and then wherever you're going, that would actually be, let's say, 7 o'clock their time. Of course, it'll be hard to get to 7, but you want to start moving your bedtime back to 9:30, and then to 9, and then to 8:30, and then to 8, slowly adjusting to what that time will be there, and your body naturally compensates easier once you get there. And then again, melatonin is perfect because a lot of your circadian rhythm is the biggest influence of your circadian rhythm is light, so natural light, and then melatonin. So once you get to wherever you're going, as much light as possible during the day. Even if you're sleepy, even if that's your normal nighttime, get out during the day, get the light, because that tells your mind it's time to be awake and alert. It's daytime. And then whenever the nighttime is there, you want to take your melatonin. Really for jet lag, it actually should be closer to 2 to 3 hours before you're falling asleep. And that helps to transition easier. So some people, once they get somewhere, they're like, oh, I'm so tired. It's nighttime in my place. And so your natural inclination is to go to sleep. But actually, you want to do the opposite. You want to get as much daylight as possible during the day, and then make sure you have your melatonin to help shift overnight.
Thank you very much. This one from Abby. What foods are rich in magnesium?
Yeah, so your dark green leafy vegetables like spinach, your nuts like almonds, cashews, legumes, certain wheats are rich in magnesium. I tend to say, you know, if you stick with your dark green leafy vegetables and nuts, you'll get a pretty good dosage of that.
Thank you. Another question from Dr. Bill. Does age impact the amount of available melatonin?
That's an excellent question. So there have been studies looking at this, and we definitely need more research into it. I would say the results have been slightly equivocal, but there have been some smaller studies to suggest that as you get older, the amount of melatonin that's released is less, and which is why people of higher age tend to respond better to melatonin. So I think just in general, there is definitely variability in the amount each individual releases. But for sure, there's a study done in individuals over 55 who really was just tracking their response to melatonin over time, but it also measured their natural release. And it did find that most of them had a lower release of melatonin than younger individuals, and even over time, their melatonin release decreased. So they were more likely to respond to the exogenous.
Thank you. Now let's move on to Lawal Toyin. Thank you, Dr. Angela Holliday-Bell. Kindly shed more light on snoring and what are the remedies?
Yeah, that's also an excellent thing to pick up. So when it comes to snoring, when it comes to sleep in general, I kind of put sleep disorders in two separate buckets. So there, I would say the vast majority of sleep issues are cognitive behavioral issues. So like chronic insomnia, anxiety, stress, lack of a good sleep routine and hygiene. But there are also medical sleep disorders like obstructive sleep apnea, restless leg syndrome. And so when I hear snoring, the first thing that goes off in my mind is obstructive sleep apnea. And unless you address that underlying problem, you're unlikely to be successful in addressing sleep as a whole. For sure, it can be multifactorial, but you want to make sure you are having a patent airway, that you're getting enough oxygen to all of the organs of your body, because with obstructive sleep apnea, you have a buildup of carbon dioxide, you're not getting enough oxygen that leads to poor quality sleep and all of these things down the line. So when I think of snoring, see your sleep physician, make sure you don't have obstructive sleep apnea. And then if you don't, there's some other kind of positioning things. There are like the kind of mouth positioners or nasal tape that you can do to help with the active snoring, but you just want to make sure it's not coming from a pathological place.
All right, I want to go to the chat. I see Dr. Ajagbe, you have your hand up. Can you please unmute and ask your question?
Thank you very much, Dr. Holliday-Bell. I have two comments. The first one has to do with my memory about when I was in high school, that we used to have a siesta period during the day. It used to be like 1 hour sleep, and I think it's usually after lunch. And then we will come back to school and finish school, and had exercise time and before dinner, and then we'll go back to class and have what we call prep. And then from prep, we will go back to sleep. And it used to be very effective because most of the time, you mentioned something about the dip in our sleep, in our alertness during the day. I think the timing was very perfect because after lunch, most of the time, the young person feels a little drowsy, wants to go to sleep, want to take a nap. Yeah. But they made it a mandatory thing that you have to go and observe a siesta. In fact, you get punished if you didn't observe your siesta. I don't know whether I'm the only one that went to such a high school, but but I think that probably explains why the sleep pattern seems to be regularized while we are growing up at that age. The second comment I want to make has to do with the obstructive sleep apnea. You just mentioned it a few seconds ago, and you literally just took the words out of my mouth, because somebody who has upper airway restriction that has nasal blockage, either partial or complete nasal blockage with mouth breathing, such individual cannot sleep well at night. Doesn't matter what the chemicals they are using, because if there is a physical obstruction to the airflow, they would not be able to sleep very well. In addition to that, those who may have such conditions might benefit from certain vegetables. One of them that has been, is very common in Mexico, used to be called chaya among the Mexicans. The Mayans used that centuries ago, and they never fell ill. In Africa, particularly in Nigeria, we call it hospital too far, or the Catholic vegetables. It's the same thing as the Jatropha tangerensis, which is similar to what we used to call lakbalakba in Yoruba. And that is very, very good for sleep. If you use it as a tea, or you actually eat it as a vegetable as part of your meal at night, you will not be having any of such sleep interruptions as being described. The other thing that you could also add to your evening, winding down thing is, if you can find the orange leaf tea is another calming in addition to chamomile. Thank you.
Yeah, thank you for that.
I went to the same type of school. We all had siestas. If you went to boarding school in Nigeria, I think it was standard. I don't know what they do now, but it was nice.
That's excellent. They actually have studies on some cultures that still have siestas, and they are much less likely. And I'm sure there are some other co-founders, their diet is typically a little healthier than ours and such, but they tend to have less of those conditions that we talked about. And we think that the siesta is a big part of that. They do partake in that natural kind of sleep drive. They tend to get more sleep. They prioritize sleep. They tend to be less stressed, and so on and so forth. So I wish every school would do that. I actually think that's
Yeah.
Thank you very much. Dr. Bill Craig, please unmute and ask your question.
Okay, I'm doing it now. Doing it now. Okay, doing it now. Let me get out of this. Okay. Unmute.
We can hear you, so ask your question.
We can hear you. You just muted yourself now. You were on, now you're muted.
Better?
Go ahead, let's talk.
Dr. Holliday-Bell, thank you for what you bring forward. Wonderful things. Just in terms of the magnesium, naturopathically, they've been doing research with that in terms of how the body receives it much more efficiently. And they've discovered that magnesium should be taken in combination with calcium in a 2-to-1 ratio, with calcium 2 and magnesium 1. We tend to absorb it in a much better and efficient way. Also, there are many, some studies out there in terms of the way in which we chelate different vitamins and minerals. And the chelation items become significant, as in the orotate entity and or the picolinate entity. It allows whatever we're taking absorbed in a better way completely. There is something also which we all know and or realize, that when we eat and put foods into our system, blood moves to the at that point, which triggers the sense of sleepiness that we eat. And I think that is something that we will all, in particular, we can counter even want to, but something that we are of in terms of its power and effect upon our bodies. Dr. Ajabe, I too went to school where they made us sleep immediately after, after lunchtime or whatever it was. So maybe it was an old way of doing things. I don't know whether I slept then because we always talked and everybody got punished. But anyway, it was something that I did experience too along the way. Again, Dr. Bell, wonderful. Thank you very much for your info.
Thank you. Thank you for that additional information.
Thank you.
And next is Dr.
So,
Nelson.
Um,
You can come in.
I'm sorry. Thank you so much, Dr. Bill. The Dr. Nelson Aluya, our own president at NAPAC, kindly unmute yourself and you have the floor.
Yes, thank you very much, Dr. O. It's a pleasure once again to be here. I'm sorry I can't share my face because where I am is pretty dark and I just came out from a conference. But I, of course, cannot miss Dr. O's Monday energy talks. So, Dr. Holliday-Bell, thank you so much. Great work you've done. I joined a little late, but from all the things I've heard, often enough people tend to forget how important sleep is and what are the contributions of an ideal sleep schedule that individuals have. And it begins how much it affects the functionality of the individual for a whole variety of things, from how the heart works, how the brain works, and even aging in itself. All of these things are affected by sleep. I'll throw back a little bit. One of the biggest issues, and if you look at the study, I'm sure you've seen that, how much is spent on sleep deprivation and correction. We're talking about billions of dollars being spent. As a matter of fact, the individual that we so know well, who is a great talent, a bundle of talent that died as a result of seeking sleep, is Michael Jackson. He was using propofol to keep himself to go to sleep. People tend to forget that, Michael Jackson did. He's not the only one that was doing it. A whole lot of people were doing it. It's just that, one, he died out of it and he's famous. So it became a big issue. Now, and that's why it's so important. And before I go into a little bit of what I was going to say, they threw in, the issue of the sleep that everybody did when they were in high school, especially in Nigeria. I went through the same thing too, and we're forced to go to bed and sleep in the daytime. And if somebody does a great analytical study to see how much effect has that gone to do with what we have right now, we'll be shocked. That is it contributing to delinquencies that we see? Is it contributing to increase rate of diabetes that we're seeing in our community? Is it increased rate of disease proliferation and everything else? Because if you lack sleep, one of the things that would truly begin to take place in your body is a hyper-inflammatory state consistently. Check those ESR and CRP. They're constantly high.
Yeah.
And that affects every single part of your body. Now, on talking about hyper-inflammatory state, chronic medical issues, chronic medical diseases affect how we sleep. And I'm sure probably, I wasn't sure, maybe you talked about that. Because melatonin, as we know, is produced by the small pea body from pineal body, and it's taken from there down to the liver where it's metabolized into the active ingredients that results in sleep. Now, the half-life is about 20 to 15 minutes, they say. And if you take a 10 milligram tablet of melatonin, it will last 5 half-lives. That's about five hours. You totally eliminate it from your body. Now, I want to you to probably talk a little bit about that, chronic medical disease and sleep pattern and how it affects. Because on the long run, especially in our community where we have disease rampant, hypertension, chronic kidney disease and liver disease and heart disease, these things are really beginning to affect us as well. Now, before I go, magnesium, great. I mean, I learned a lot today, but one of the biggest things I've always learned about, I know about magnesium, and I teach my residents, is that it's used often as a tocolytic. It's also used in acute severe asthma that don't respond to regular albuterol or nebulizer. And then the next phase you do is you use magnesium. So as we talk about magnesium, we need to be careful as well, because magnesium would depress your respiratory centers because it's a smooth muscle relaxant, and it really does relax our smooth muscles. So as we do that, please don't go and take one tablet of magnesium, don't go to sleep, take another one, take another. You know, you gotta be careful with all of that. So thank you, and I appreciate what you just did. God bless you.
Yeah, no, thank you for that. You brought up a great point. And we have, natural, things that we consider natural as supplements. We still have to be careful in the doses that you take. So I always recommend taking the daily recommended amount of magnesium, which for women, 310 milligrams, for men, 420 milligrams, and no more than that. And it really helps, like you said, relax the smooth muscles. It's not necessarily something that's going to be a switch to put you to sleep. It helps to facilitate it along with everything else you're doing. So you definitely need to be careful. And I think you hit on a good point in that the chronic disease is kind of a chicken and egg thing when it comes to sleep. And that lack of sleep definitely contributes to an inflammatory state in chronic disease, but chronic disease can interfere with your ability to sleep and get quality deep sleep. So it can be hard, to balance the two. I think across the board, improving sleep will improve overall health. In managing your condition, as best you can, especially when it comes to chronic pain. Unfortunately, people who have chronic pain obviously are not sleeping well, not getting into those deeper stages of sleep, not getting all the healing benefits of the deep stages of sleep. So it becomes tricky. But I think trying to keep, work hand in hand and really utilizing the natural healing benefits of natural non-prescription medication sleep, I think is super helpful.
Thank you so much. Dr. Moses' comment, thanks for the detailed discussion of this menace called insomnia. Dr. Holliday-Bell, what do you suggest to clients that claim that melatonin has not been effective in maintaining sustained sleep?
So I think that's actually the most, it's very common, and it makes sense in that taking melatonin, as was previously mentioned, melatonin doesn't have a super long half-life. So it's just standard melatonin is better for sleep onset insomnia, helping you to get to sleep. It doesn't necessarily help you maintain sleep. However, the new formulations of the prolonged or time release do have a better benefit of helping you maintain sleep, because it gives you little doses throughout the night. You do have to play with, what dosage is right for you, because you don't want that kind of hangover drowsiness the next day. But I would say if someone's using melatonin and it's not getting the effect that they want specifically for sleep maintenance, I would try the time to release melatonin.
Thank you so much. Emmanuel Boyega says, thanks, Dr. Bell. Technically, what is sleep? How is it different from nap? And what is power nap? How important is positioning for effective sleep?
So sleep and nap are the same. The difference is the length and the amount of sleep stages that you go through. So sleep is a recurrent state of mental and physical rest that goes through standard stages, standard kind of reproducible stages. So it's literally just mental activity in a state of overall physiologic rest that your body naturally cycles through. Nap is that, it is sleep, but nap tends to be shorter, so you tend not to cycle through. On average, most people cycle through 5 sleep stages. For a nap, generally you shouldn't even really complete a full sleep stage, but depending on how long you're sleeping, you may sleep longer than that. And a power nap is really just utilizing the restorative benefits of your N1 and N2 stage sleep, which are the later stages. So like N1 is a type of sleep that you may not even realize you're asleep. You're kind of dozing off and you're looking around like, was I just sleep? That's N1, but you also still get some restorative benefits from that, as well as N2, but it's not the deeper stages of sleep that are harder to wake up from. So you're basically keeping yourself from going too deep into sleep that it's hard to wake up, but still getting the benefits of the lighter stages. Thank
you so much. Dr. Ajagbe, please unmute and ask your question.
Yeah, I just want to add something about the prevalence of excessive daytime sleepiness that many people experience. It is imperative that we will watch our wakefulness during the daytime. And, if we find out that we are falling asleep, we can't even stay awake for extended period of time during the day without, falling asleep, then we need to seek help. And I think a simple survey or simple questionnaire will be very helpful in, indicating whether there's a deeper need for help than just assuming that, oh, this is how it is in my family. We can't sit still without falling asleep during the day. That kind of a thing should be evaluated.
Agreed.
Thank you for your comment. Now back to Emmanuel Boyega. So, to what extent is it true that peaceful coexistence with others, especially at home, and good sex stimulate good sleep?
One of the biggest contributors to insufficient sleep and insomnia are stress and anxiety. And so all the things you do surrounding your day-to-day functioning, especially at home, and the things that relax you or cause you stress will definitely contribute to poor or good sleep. So if you have a good coexistence with others, if you get home and you're like, oh, I'm relaxed and I'm happy, that definitely facilitates you being able to fall asleep. Sex stimulates the release of endorphins, makes you feel good, makes you feel more relaxed. So same type of thing. It helps you to overall feel relaxed, and in that relaxed state, it's much easier to fall asleep.
Thank you very much. Dr. Buka asked, how do I adjust to time difference of 6 hours ahead of going to Africa for a medical mission?
Yeah, so 6 hours is a tough one to adjust to, but I would slowly, in your case, start to move your bedtime forward a little bit. You want to be careful because if you have other obligations, so let's say you have to get up for something the day prior to that, you don't want to decrease your sleep too much. But if you don't have obligations prior to that, I would slowly push your bedtime back, more closely match the bedtime in Africa. 3 days before your trip, I would start to take the melatonin later at night. And then again, during, once you prepare, lots of bright light during the day and make sure dark melatonin.
Dr. Adewale Opeyemi asks, do you discourage habits of lying down to relax for more than 20 minutes, or do other things in bed? What is the implication?
I do actually. So I think that totally fine to relax. Of course, I think you should have a separate space for that when you get home, because you want to hit your bed, and fall asleep. And if you're not at your bedtime, you want to prevent yourself from doing that because you don't want to mess up your kind of circadian rhythm. And so I would say, even just to relax, you want to avoid doing that in bed, and certainly want to avoid doing other activities in bed, because you want that relationship between mind and bed to be so strong that when you look in your bed, like you can't lay in your bed for 20 minutes without falling asleep. That's what you want. So you want to kind of separate relaxing, because relaxing is different than sleeping, right? You want to separate where you relax from where you actually fall asleep.
Another question from Dr. Opeyemi. Some people are more active at night than others. How do such people balance daily sleep requirements of more than 7 hours? Or for those people, is it a matter of sleep quality for them rather than the quantity?
Yeah, so I think that varies by individual, right? So some people, so there are things called sleep chronotypes, which is night owl, early bird, bear, you may have heard those terms. And there's a genetic and biological basis to those things. So your night owls will naturally have more energy later at night because their circadian rhythm is kind of shifted a little bit so that they kind of get that burst a little bit later. However, when it comes to regulating your sleep in the societal norms, where you have to get up a little bit, earlier and go throughout your day as an early bird, so to speak, it's harder to do that. As long as you're getting enough sleep to meet your sleep need and function optimally, you can be as active as you want. If your sleep need truly is only 7 hours, you can go to sleep at midnight and wake up at 7 and still have the optimal amount of sleep. But for instance, if you're someone like me who happens to be not only a genetic long sleeper, but a night owl, I had to really change things because it didn't coincide with my kind of societal and daytime structure. So I had to adjust my circadian rhythm so that I got sleepy early, woke up early, and I actually missed my natural energetic time, which would probably be closer to like 11 p.m., but that doesn't kind of work for my schedule. You mentioned on quality versus quantity, which actually is a good point. So those are two facets of sleep that are both important in their own right. And I actually say quality is more important than quantity. So many people start to, if I just get these 7 hours, then I'm good. But it's actually better to get 6 hours of quality sleep than 8 hours of broken sleep. So the timing is not as important as the quality. And then once you get quality, you can work on increasing the time of that.
Thank you so much. It's been an interesting discussion talking about sleep and all that you need to do to get that important sleep, making it our priority. It's now time for our Medical Monday moment of inspiration.
What an amazing time. I have learned so much. I still can't get over the magnesium, dude. Thank you so much. Sleep is important. We all need it. And I pray that the session tonight would charge us to pay more attention and to be better. My Medical Mondays moment is, the fact that on this forum, we have some amazing people that I have had the opportunity to interact with in the past 3-4 weeks of Medical Mondays forum, but in our small group that in a few months, in 3 months or so, we will reveal and share what we're learning and what we're doing. But it blows my mind to see the amazing people that we meet every Monday on this forum who are interested in each other, who want other people to be good, to be better, who share things that benefit others. And I'm just so grateful to be here. I'm so grateful for every single one of you. I am excited that the Lord has blessed us with each other, and I'm participant in this group. That's my moment this week. Thank you, everybody. Thank you, because you make Medical Mondays. And next week we have a speaker coming from Britain. It's 5 hours ahead. So 7 p.m. here is 12 midnight over there. And is a psychiatrist coming to talk to us about what is, endemic to all of us. That word love. But stay tuned for what the topic says exactly. I don't like to give it away. But by Saturday, Sunday, you'll get a gist of what it is. Monday morning, definitely, you will know what it is, but it's going to be an exciting time next week. Dr. William Craig has his hand up. You are unmuted, sir.
Dr. Bell, again, thank you very much for this. One quick question, because I know we're getting ready to go to sleep. You haven't mentioned REM sleep at all. Is REM necessary, and or are there stages of sleep, whether it's light, medium, or deep, which gives us that sense of relaxation and as if we've been refreshed? How important is that we need to reach that REM stage? And also, where does it occur in our sleep, whether it in middle sleep, beginning, or end sleep?
Excellent question. So for sure, REM sleep is important. It has its own function. So every stage of sleep has its own functions. The most restorative stage of sleep is actually your deep sleep, which is N3. It used to be N3 to N4. Now they've kind of put those together in deep sleep. REM sleep actually functions to help you lay down memory, cement new things that you've learned. And especially like in babies and infants, that's when all the neuronal connections are made. And so for sure, it's important. As you go throughout the night, you get less and less REM sleep actually. So you get more REM sleep in the middle of the night, kind of that first third. And then as you go throughout, you get less, but it definitely has its own function. So there are some people, they've done studies on people where they've interrupted them right before REM sleep. So you have like your N1, N2, deep stage REM. So it's at the end of a cycle, but then you continue to cycle, and then the amount of time you spend in REM is less and less as you go throughout the night. And what they found is like they were less likely to remember things they had learned before the night before. They were less likely to perform as well on tasks if they missed that REM sleep, although they still got that restorative sleep. So that's why I tell people it's so important that you naturally cycle through all of your sleep stages, because yes, you get benefits from each one, but they're all so important to work together. And so you get some of that extra kind of function and restorative properties from even the light stages of sleep, but you won't get all of the many benefits of sleep if you don't kind of cycle through them throughout the night.
Thank you.
Absolutely.
Thank you so much. And I just want to mention again that next week we're going to talk about love. Remember, February is Love Month also. Yeah, it's Black History Month. Yay! And it's Love Month. So we want to conclude with that love. And I want to thank Sister Lola for making this happen. She's going to be a Medical Mondays gift recipient for this week. She actually introduced Dr. Angela Holliday-Bell, who is the colleague of her son, to speak tonight. And she came after me. Have you contacted her? Have you contacted her? That's what Medical Mondays is about. It's about all of us. See how blessed we are. So if you're interested in a particular topic that we have not done, or you want it, elaborated, repeated, please text me or email me, and by God's grace, we'll make it happen. And if you have a great speaker like Dr. Angela Holliday-Bell that you would like to come, impact us in one way or the other, make the introductions and we will make it happen. Thank you, everyone. Our Medical Mondays family, we are grateful. And Dr. Holliday-Bell, if you please give us your, conclusion, just tying everything up together for us, to give us your take-home message. That would be fantastic.
Absolutely. First of all, thank you again so much for having me. This was excellent. Thank you for all the questions and the comments. I even learned some stuff during this talk, so this was amazing. Thank you so much for having me. I would say if you guys have one thing to take away, it's prioritizing sleep is prioritizing yourself. So put yourself first by putting your sleep first, and don't ever feel bad about doing it, because that is a way to live the happiest, healthiest life that you can. So always work to put yourself in your seat.
Thank you so much. You've been listening to Dr. Angela Holliday-Bell, and this evening we discussed the importance of sleep, how to sleep your way to a healthier you with Dr. Angela Holliday-Bell. She is a certified clinical sleep health specialist. Thank you so much for joining us. It's been another wonderful time. But remember to share the link with your family. We are on YouTube. You can catch up with all the past and previous editions of Medical Mondays with Dr. O. Until we come your way, the same time next week, remember to prioritize sleep. Good night. Love you all.
Take care.
Good night.
Good night.
Love you all. Thank you so much.
Hi guys, thanks so much for having me.
Thank you. Good night.
Thank you, Dr. O. Good night.
Thank you. Thank you, Sister Edna. Good night.
Good night.
Good night now. Good night.
Good night, sir.
Right.
Good, sir. Thank you so